everyone, and welcome to my presentation. Thanks for watching. My presentation focuses on one of the most influential figures in nursing, Hildegard Peplau, and her foundational work, the interpersonal relations theory. We'll look at who she was, how her theory developed, the core concepts it includes, and how it continues to impact nursing practice today and in the future. Hildegard Peplau was born in Reading, Pennsylvania in 1909 to a working-class family. Her early experiences during World War I, observing the emotional toll it had on individuals and communities, sparked her desire to understand human behavior and contribute to healing. She began her nursing career in 1931 and went on to earn a master's degree in psychiatric nursing from Teachers College at Columbia University, and later an educational doctorate from Columbia as well. Peplau's service in the U.S. Army Nurse Corps during World War II exposed her to the psychological impact of war, trauma, and interpersonal dynamics in high-stress environments. These experiences deeply influenced her perspective on patient care and human relationships. She is remembered today as the mother of psychiatric nursing for introducing the concept that nursing involves a significant psychological and emotional component, not just physical care. Her work permanently shaped the field of psychiatric nursing and laid the foundation for modern therapeutic communication. Peplau developed the interpersonal relations theory throughout the 1940s, during a time when nursing lacked a formal theoretical framework. Her theory was first published in 1952 in her book, Interpersonal Relations in Nursing. What set Peplau apart was her ability to merge theory with practice. Her ideas were not abstract, but rooted in actual clinical experience, especially within psychiatric settings. One of her key influences was psychiatrist Harry Stack Sullivan, whose interpersonal theory emphasized the role of relationships and mental health. Peplau expanded on these ideas from a nursing perspective. She introduced the idea that nurses do not simply carry out doctors' orders, they form therapeutic partnerships with patients. Her theory was grounded in psychodynamic nursing, meaning it incorporated insights from psychology and psychoanalysis, especially Freudian and Neo-Freudian models. She believed that both the nurses and the patient's behaviors and emotions influence the therapeutic process, and that self-awareness in the nurse is critical to effective care. By defining nursing as an interpersonal and therapeutic process, she gave nurses a sense of professional identity, autonomy, and responsibility in fostering psychological well-being, not just managing symptoms. Her work paved the way for nursing theories that would follow, making her one of the first true nurse theorists in history. At the heart of Peplau's theory is the nurse-patient relationship, which is purposeful and therapeutic. The theory outlines 4 phases of the relationship: orientation, identification, exploitation, and resolution. Orientation is the initial interaction. The nurse and patient meet, the patient expresses their need, and trust begins to form. The nurse assesses the patient's condition and introduces the process of care. Next is identification. In this phase, the patient begins to respond selectively to those who offer help. They start identifying the nurse as someone who can support them. A collaborative dynamic begins to form as the patient engages more in their care. Next is exploitation. Here, the patient is actively using all services provided and is participating fully in the care process. They may ask questions, express concerns, and implement coping strategies. The nurse supports independence and growth. Lastly is resolution. The therapeutic relationship concludes as the patient's needs are met, emotional ties are resolved, and the patient moves forward with greater autonomy. A successful resolution reflects emotional maturity and self-reliance. Peplau also identifies 6 roles the nurse may take throughout these phases. They are stranger, resource person, teacher, leader, surrogate, and counselor. So first is stranger. At the beginning of the relationship, the nurse is a stranger. It's important for the nurse to offer the patient an accepting and open presence, treating them with courtesy and professionalism to establish trust. Next is resource person. In this role, the nurse provides specific, accurate information that helps the patient understand their health condition and the services available. The nurse may act as a guide or expert, supporting informed decisions. Next is teacher. Education is a key part of nursing. The nurse teaches the patient about their illness, medications, procedures, and how to manage symptoms or maintain wellness. Teaching encourages the patient to take charge of their own health. Next is leader. Here, the nurse helps structure interactions and decision making. The nurse empowers the patient to participate in their own care and leads by example, promoting mutual respect and shared goals. Next is surrogate. The nurse might temporarily fill roles that remind the patient of significant others, such as a parent, sibling, or authority figure. This role requires careful navigation to maintain professional boundaries while offering appropriate emotional support. Last is counselor. This is often the most emotionally involved role. The nurse supports the patient in exploring feelings and coping with stress or illness. The focus is on building emotional insight and helping the patient understand their own behavior and choices. Peplau's theory had a major influence during the 20th century, especially in psychiatric nursing, where it provided a structured, evidence-based framework for therapeutic communication. Before her contributions, nursing was primarily task-oriented, but her theory brought focus to the psychological and emotional components of care. It guided the development of patient-centered nursing education, and nursing schools incorporated her concepts to teach students how to develop effective, empathetic relationships with patients. In practice, her theory also influenced recovery-focused mental health care, shifting attention to patient empowerment and engagement. The emphasis on building therapeutic alliances led to improved outcomes in psychiatric settings and helped establish nursing as a profession rooted in both science and empathy. Peplau's theory remains highly relevant in today's nursing landscape. Currently, it guides care and mental health in psychiatric nursing, but also plays a vital role in acute care, rehabilitation, and long-term care environments. In these settings, the nurse-patient relationship remains central to recovery, especially when dealing with chronic illness or behavioral health issues. Looking to the future, the theory is increasingly relevant in the growing field of telehealth. In virtual care, where physical presence is limited, Peplau's focus on interpersonal connection provides guidance for building trust and rapport through verbal and nonverbal communication. The theory also complements trauma-informed care, where reorganizing emotional responses and prioritizing psychological safety are crucial. Finally, in our increasingly diverse patient populations, Peplau's emphasis on empathy and understanding supports culturally competent care, helping nurses meet the emotional and relational needs of individuals from all backgrounds. In conclusion, Hildegard Peplau transformed nursing from a task-based profession to one that values human connection. Her interpersonal relations theory helped nurses understand that their interactions with patients were not just routine exchanges, but vital to recovery and growth. She emphasized the need for strong communication skills, emotional intelligence, and psychological insight. Her framework gave nurses a roadmap for establishing trust, promoting patient independence, and achieving meaningful outcomes through therapeutic relationships. Even today, Peplau's ideas shape how we teach, train, and evaluate nurses, not only in psychiatric settings, but in every area where human interaction is at the core of care. These are just my resources that I used, and that is the end of my presentation. Thank you for watching. Bye.